Hello, my friends. I'm Dr. Susan Parker, urologist and kidney health specialist. And today, I want to talk to you about something most people ignore every single day. The message your urine is sending about your kidneys. Many people think kidney problems only show up when there is strong pain or when the doctor finds something alarming on a blood test. But in reality, your body often whispers long before it screams. And one of the clearest whispers comes every time you go to the bathroom. If your urine starts to look, smell, or behave in a certain way and you ignore it, you might be overlooking one of the earliest warnings that your kidneys are under stress. On the other hand, when you learn to read these signs calmly and clearly, you gain an incredible advantage. You can seek help early, protect your kidneys, and often avoid much more serious complications later on. That's exactly what we're going to do together today. I'm going to walk you through the main changes in your urine that should make you stop, pay attention, and think, I need to check my kidneys. Let's start with something very simple. What does normal urine usually look like? For most people, healthy urine is a light straw or pale yellow color, clear, and with a mild smell. It comes out in a steady stream, doesn't burn, and you're able to empty your bladder without straining. The exact shade can change during the day. When you drink a lot of water, it may look almost transparent. When you haven't had much to drink, it gets a bit darker. That's normal. What is not normal is when your urine consistently looks very different day after day in ways that don't match your hydration or diet. That's when it may be warning you about your kidneys. The kidneys are like your body's natural filters and regulators. Every minute, they are cleaning the blood, removing waste, balancing minerals, and controlling how much water you keep or release. Your urine is the final report of all that work. When the kidneys are healthy, that report looks fairly predictable. When they are stressed, damaged, or inflamed, that report starts to change. Often silently, without pain, without fever, without dramatic symptoms. That's why understanding what your urine is trying to tell you can be so powerful. The first warning sign I want you to remember is persistently very dark urine, especially if it looks like concentrated amber or even cola or tea. Yes, dehydration can darken your urine. If you've been sweating, spending time outdoors, or simply not drinking enough, your urine will naturally get more concentrated. You drink a few glasses of water, and it usually returns to a lighter shade in a few hours. But if your urine remains very dark even when you are drinking well, that's not something to brush off. Very dark brown or cola-colored urine can signal the presence of blood, muscle breakdown products, or high levels of certain pigments. In some cases, it can be a sign of kidney inflammation, kidney damage, or a serious condition affecting your muscles or liver. If you notice that your urine has turned into a color that reminds you of tea, cola, or dark syrup, and it stays that way, your kidneys deserve immediate attention from a professional. The second warning sign is red, pink, or visibly bloody urine. This one tends to scare people, and honestly, it should never be ignored. Sometimes the explanation is harmless. Eating large amounts of beets or certain berries, for example, can tint urine for a short time. Some medications can also give it a strange reddish tone. But true blood in the urine, what we call hematuria, is a red flag. It might come from anywhere in the urinary tract: the kidneys, the ureters, the bladder, the prostate in men, or the urethra. From the kidney's perspective, blood can be a sign of kidney stones, kidney infections, inflammation of the kidney's filtering units, or even kidney tumors. Not all blood is visible. Sometimes the urine looks normal to the naked eye, but microscopic blood appears on a laboratory test. That's still important. But when you can actually see that your urine looks pink, red, or rust-colored, and you know it's not from food or medication, it is not something to wait on, especially if it is accompanied by back pain on one side, pain when urinating, fever, or clots in the urine. Your first step is not to panic, but also not to pretend it isn't happening. Contact your doctor or urologist and be honest. My urine looks bloody. I need an evaluation. Your kidneys will not regret that decision. The third warning sign is urine that looks foamy or excessively bubbly, like the head of a beer that doesn't quickly disappear. Almost everyone has seen a few bubbles in the toilet from time to time, especially when the stream is strong and hits the water with force. That's not a problem by itself. What concerns me as a urologist is persistent, thick foam that appears repeatedly, even on days when your stream is gentle. That kind of foam can be a sign of protein in the urine, what we call proteinuria. Your kidneys are supposed to keep important proteins in your bloodstream, not let them leak into your urine. When those filters are damaged, proteins slip through and end up in the toilet. Over time, this can be a strong signal of kidney disease, including conditions related to diabetes, high blood pressure, or autoimmune problems. Many patients with early kidney damage feel completely fine. They have no pain, no fever, no obvious symptoms. Their only warning sign is that their urine has become strangely foamy. That's why it's so important not to ignore this. If you notice persistent foam that seems unusual, ask your doctor for a urine test that measures protein. It's simple, inexpensive, and can reveal kidney disease long before you feel sick. The fourth warning sign is cloudy, murky, or milky urine, especially if it is accompanied by discomfort, burning, or an urgent need to urinate. Cloudy urine can have many causes. Sometimes it is related to crystals, bacteria, or white blood cells. Infections of the urinary tract are a very common cause, especially in women, but men can get them too. While a lower urinary tract infection mainly affects the bladder, if it spreads upward, it can reach the kidneys and cause a more serious infection called pyelonephritis. Cloudy urine, a strong, unpleasant smell, burning, pain in the lower back or side, fever, chills, and fatigue can all be part of that picture. When the kidneys are involved, the situation becomes more urgent. Kidney infections can damage kidney tissue and make you very ill if they aren't treated quickly. So, while cloudy urine by itself doesn't always mean kidney emergency, cloudy urine plus pain, fever, or feeling very unwell should push you to seek medical care promptly. Think of cloudy urine as your body saying, "Something is growing here that doesn't belong." Your kidneys are vulnerable when infections are ignored. The fifth warning sign is urine that is almost always colorless or extremely pale, regardless of how much you drink. Many people believe that perfectly clear urine is always a sign of great health. In reality, occasionally, clear urine is fine, especially if you just drank a lot of water. But if your urine is consistently as clear as water, day after day, it may mean your kidneys are not concentrating your urine properly. The kidneys have the job of deciding how much water to save and how much to let go. When that concentrating mechanism is damaged, you may produce large volumes of very dilute urine, even at night. This can be related to certain kidney diseases, hormonal imbalances, or conditions like uncontrolled diabetes. You may notice that you are always thirsty, always drinking, always urinating, and never feeling truly satisfied. You might be getting up multiple times every night to urinate. Over time, this constant cycle can exhaust you and strain your kidneys further. Again, the key is pattern. If you have one day of very clear urine after a hot day and a big jug of water, that's normal. But if water-clear urine is your daily reality and you're running to the bathroom constantly, your kidneys and your hormone balance deserve a closer look. The sixth warning sign is orange or very bright yellow urine that doesn't match your diet or supplements. Certain vitamins, especially B vitamins, can make your urine neon yellow. Some medications, such as those used for urinary discomfort, can turn urine orange or even blue-green. When that's the case, you usually know why it's happening. The color change starts after you begin the medication and stops a few days after you discontinue it. But orange or dark yellow urine accompanied by pale stools, yellowing of the eyes or skin, itching, or fatigue can point to issues with your liver or bile system, which can indirectly affect your kidneys as well. The liver and kidneys work together as part of your body's detox and filtration network. When one is overwhelmed, the other often has to work harder. So in this case, the color of your urine might be pointing not only to the kidneys directly, but to the wider system that protects your internal environment. If you notice persistent orange urine, and you are not taking a medication or vitamin that explains it, especially if you see other changes in your body, do not dismiss it as just a weird color. It is another example of how your body uses urine as a visible signal. Now let's talk about smell and frequency, because they also give important clues about your kidney health. Urine has a natural, mild smell. After eating asparagus or certain foods, it can take on a stronger, unusual odor for a short time. That's normal. But if your urine consistently smells very strong, sweet, fruity, or foul, this might point to infections, high levels of certain substances, or poorly controlled diabetes. Sweet or fruity urine can be related to high sugar levels spilling into the urine, something that often goes hand in hand with kidney damage in people with diabetes. Frequency also tells a story. Waking up once at night to urinate can be normal, especially as we age. But waking up 3, 4, or 5 times every night for weeks, combined with changes in the appearance of your urine, swelling in your ankles or around your eyes, fatigue, or shortness of breath, should immediately make you think about your kidneys. When the kidneys are not working properly, the body may retain fluid in some places and dump it in others. You might notice rings that feel tighter, shoes that leave marks on your ankles, or weight gain from fluid instead of fat. All of this can coexist with urine that simply doesn't look right. At this point, you might be wondering, how do I know when a change in my urine is urgent and when I can just observe it for a few days? Here is a helpful way to think about it. If the change is very dramatic, bright red blood, dark cola color, severe pain, fever, vomiting, difficulty breathing, or you feel extremely unwell, that is not a wait-and-see situation. That's a go-now situation, whether to an urgent care clinic or an emergency department, depending on how bad you feel. But if the change is subtle, slightly more foam, a bit darker color, mild increase in frequency, the key is to observe and document. For 1 or 2 days, pay attention. Are you drinking enough water? Did you eat anything that could alter the color? Did you start a new medication or supplement? If the answer is yes, and the change disappears in 24 to 48 hours, it was probably harmless. But if the change continues beyond that, or if patterns keep returning, persistent foam, recurring blood, ongoing cloudiness, constant nighttime urination, it's time to involve your doctor. Bring a detailed description. How long it has been happening, how often, what it looks like, and what other symptoms you have noticed. This gives your doctor a powerful head start in protecting your kidneys. I want to share a simple example from my practice, without revealing any names. A man in his 60s came to see me because his wife insisted something was wrong. He felt fine. No pain, no fever, no burning. The only thing he had noticed was that his urine had become a bit foamy over the last few months. He assumed it was nothing. His wife, however, had seen one of my talks and recognized that foamy urine could mean protein loss. She convinced him to make an appointment. We did a basic urine test and some blood work. The results showed significant protein in his urine and early kidney damage related to long-standing high blood pressure that had never been tightly controlled. Because we caught it early, his primary doctor was able to adjust his medications, support his blood pressure more effectively, and refer him to a kidney specialist. A year later, his kidney function had stabilized. Imagine if he had waited until he felt tired, swollen, short of breath, or until his lab results were already severely abnormal. The outcome might have been very different. All of that changed because he paid attention to something as simple as foam in the toilet. I've also seen the other side of this story. People who ignored dark urine and fatigue and only sought help when their legs were swollen, their appetite was gone, and their lab numbers were frightening. Sometimes we can still stabilize things. Sometimes we can't. Kidney disease is often silent until it is advanced. That's why I insist so much on these visual clues. They are one of the few chances your body gives you to act early. If you live with diabetes, high blood pressure, heart disease, or a family history of kidney problems, your urine is even more important as a daily check-in. These conditions place extra stress on your kidneys. Even if your doctor is following your blood tests once or twice a year, you are with your own body every day. You see your urine more often than any lab technician ever will. If you combine regular medical checkups with your own quiet awareness of what is normal and what is not, you give yourself the best possible protection. So let's bring all of this together in a simple way. Your kidneys are talking to you through your urine. The messages that deserve your full attention are urine that turns dark brown, cola, or tea-colored and stays that way. Urine that looks red, pink, or bloody when you have not eaten or taken something that explains it. Urine that is persistently foamy like beer. Urine that is cloudy and accompanied by pain, fever, or feeling very unwell. Urine that is almost always clear like water while you are constantly thirsty and running to the bathroom, and urine whose changes are accompanied by swelling, fatigue, or shortness of breath. None of these things mean panic. They mean respect, awareness, and timely action. The most important message I want you to take away is this. Your urine is not something dirty you should rush to forget. It is a daily health report that can reveal trouble in your kidneys long before your body is overwhelmed. Looking at it for just a second before you flush is not obsession. It is self-respect. It is prevention. And it is one of the simplest habits you can develop to protect your long-term health. If you notice any of the warning signs we discussed today, do not diagnose yourself at home and do not rely on internet theories or home remedies. Your next step is to talk to a qualified professional who can order the right tests, interpret them in context, and guide you with a calm, personalized plan. Very often, when we act early, we can slow down or even stop kidney damage. But time matters. Thank you for spending this time with me and for caring enough about your body to learn what your urine is telling you. If this conversation opened your eyes to something you had never considered before, I invite you to reflect on your own daily habits. Have you been paying attention to these small signals, or have you been flushing them away without a second thought? If you know someone who is living with diabetes, high blood pressure, or kidney risk, share this message with them. It might be the gentle nudge they need to seek help sooner rather than later. And if you'd like to keep learning practical, science-based ways to protect your kidneys, your urinary system, and your overall health, I'd be honored to have you join me in future videos. Take care of yourself, listen to your body, and remember, sometimes a quick look into the toilet bowl can be the first step toward saving your kidneys.